It's a smaller device, smaller insertion device. The diameter of it is smaller. The length is smaller. There's some potentially new and exciting news when it comes to the world of IUDs. We're getting a new one. And, well, for the last 40 years, we only had one option when it comes to non-hormonal IUDs, and that one has its faults. Well, hopefully this one has improved a lot of those faults to give you a good, safe option. Welcome back, everyone. My name is Eric Schmidt. I'm a board-certified OBGYN. Let's help find the best IUD for you now that we have a new one in the mix. So before we go into the details and the common scenarios which might lead someone to choose one IUD versus the other, let's recap the IUDs we currently have along with the new one that we're going to have in the near future. The Paragard IUD is probably the oldest IUD that we have currently. There have been many iterations of it, but the Paragard IUD is a copper IUD where it has copper wiring surrounding the base and the arms of the IUD. That's how it works. It works by that copper interrupting how sperm normally works, and it makes an anti-sperm environment within the uterus so that fertilization never happens. Over the years, it's worked really well at prevention of pregnancy. All the IUDs work really well when it comes to prevention of pregnancy. This one's been used for approximately 40 years. It does have some faults, and some of those were that it is, well, the largest IUD is in terms of size. The insertion of it is slightly different than the other hormonal IUDs, which it makes it a little more difficult in some scenarios. We'll talk about that in a bit. And so some of these things, along with the removal of the IUD, has caused some problems also. And so I'm hoping that the new IUD, which is will be the only other non-hormonal option, improves on a lot of these things, and it seems like it will. The Miudella IUD is the new IUD to market. Again, the Paragard IUD for the last 40 years has been the only non-hormonal IUD on the market. And so it's kind of a fun, exciting time, hoping this one improves on a lot of those faults that the Paragard IUD has. So if you feel like after this talk, this is the right one for you, talk to your doctor's office, let them know you're interested, because if they know their patients are interested in this, they will order it, they will get it to you. Some of the factors that this Miudella IUD might improve on over its counterpart, the Paragard, is that it's smaller. And so it's going to be easier for some people that this IUD, it's a smaller device, smaller insertion device. The diameter of it is smaller. The length is smaller. The Paragard IUD, the one I talked about previously, is 36 millimeters in length. This one is 30, and so that's a big improvement. And the diameter, or the thickness that actually goes through the cervix, is smaller. It's 3.7 millimeters. That's even smaller than the Kyleena or the Skyla IUD, so that's a huge plus. One of the big drawbacks that I feel in my clinic is the use of the non-hormonal Paragard IUD in younger populations or people that haven't had pregnancies before, and so this could help bridge that gap. So next we're going to talk about the hormonal IUDs. The hormonal IUDs have levonorgestrel. They all have the same hormone in it, just different dosages. The Mirena has 52 milligrams. The Liletta is the same, it's just different competitors. The Kyleena has 19.5 milligrams and Skyla 13.5. The Mirena IUD, the 52 milligram IUD, it's still a very low dose of hormone, much lower seen in the systemic system than the Nexplanon device, which is also a very low dose option, even much lower than the low dose progesterone only pill would give you. Maybe 20% of what the progesterone only pill would give you. And so less chance of side effects. We'll talk about that in a minute. Hormonal IUDs, their main function in the way that they prevent pregnancy is that they make the cervix mucus, which a cervix normally has mucus inside of it, that during a menstrual cycle, it's very thick. The sperm doesn't get through. However, during certain points of the menstrual cycle, that's why when someone's tracking their cycles, they can, one of the ways to potentially know if you're near ovulation is to test the cervical mucus viscosity, and if it's thinner, so that's how the sperm gets through. Well, the progesterone IUDs work to keep that thickened throughout the cycle. And so the sperm can't get through and up into the uterus. That's how the Mirena, Kyleena, Skyla all work. So these are the main options, again, that someone is choosing between. We don't have the Miudella IUD yet, but hopefully we will in the near future. All right, so now I'm going to break down a few different categories that might help each individual person realize, which IUD might be best for them. If you have any other potential categories which you were thinking about, write them below in the comments so we can hopefully address those in the future.
Hey guys, welcome to my childhood basement. This is the window I used to potentially go out of a few times, but anyway, we are doing something big for September, a big fundraiser for the channel for a good cause. And it's a little spoiler, we're going to be posting a video every single day, 30 videos in 30 days. Right now I make 50 videos a year at the best. And so this is kind of a big thing. And we're hoping to raise money for a good cause. Through YouTube, if you want to be an official fundraiser, you need to have at least 10,000 subscribers. Now, it would be quite a challenge to get to that number in a month and a half, but if you don't mind, subscribe and maybe we can make this an official fundraiser through YouTube. If not, I'll find a way how to make an external link, but I think it'll be easier for people to potentially give and donate if they have a link right there on YouTube and can see the fundraiser. So that'd be pretty cool. But either way, we're going forward with this fundraiser for September. Either way, and so I'll announce kind of who we're fundraising for probably one of the next videos. So stay tuned. Hope you guys have a good rest of summer, and back to the video.
Let's say somebody's coming to the office, they're like, I want the best IUD at prevention of pregnancy, the one that will prevent the pregnancy at the best rate. That actually goes to the Mirena and the Liletta, and so that one's the best, plus for them. The pregnancy rates are also very low for the Kyleena Skyla. The Paragard, again, it's very low pregnancy rates with it, less than 1%, 0.8% per year initially for the Paragard, 0.2 for the Mirena, and similar for the Kyleena and the Skyla. And the Miudella also claims to be very good, similar to that of the Mirena and the Kyleena, but again, more long-term research will help. So we'll also give that one a plus minus. All of these options are very good at prevention of pregnancy, but if you want the statistically best, it's going to be the Mirena. Insertion and removal of an IUD. If you want the one that's going to have the easiest insertion, less amount of discomfort, that plus is going to go to the Kyleena and the Skyla. Both of those have a smaller diameter of the insertion device. The insertion device has a nice curve to it, which helps if a uterus has a tilt to it, because this is where the big knock on the Paragard insertion device is. There's less ways you can potentially manipulate it to fit the curvature of each individual patient, whether it's forward or backward. And so, this with the Paragard IUD, the insertion can be a little more difficult if someone has a more tilted front or back uterus. A lot of people have some tilt, but the extreme tilts. Sometimes if you're using a pretty much straight inserter device, you can a little less accommodate those curvatures. And so Paragard, unfortunately, that's one of the reasons why I really don't love it. Also, I'm sorry, Paragard, you get a double negative for the removal. There's been more issues with the removal of the Paragard IUD over the years that I've seen, where when someone's trying to remove it, part of the arm, because it's a T-shaped device, it gets stuck in the lower uterus cervix as it's trying to come out, kind of gets stuck in the muscle, and then only part of the IUD comes out. And we've had to retrieve some of these through different procedures. And so that is also something I've talked about in the past, especially in the complications video we just did. So view that if you want to know more information about that. But one of the more difficult things with the Paragard IUD, the Mirena IUD has the same insertion device as the Kyleena and Skyla. It's not quite as, the diameter is still about 4.4 millimeters in diameter. This one, so 4.4, and let's say 3.8, and then this one is 4.4. And the Miudella IUD, that one is actually going to be a plus too. This one's 3.7. I can't wait to start using this one because it will be better, because when you cannulate through that cervix, that's where a lot of the pain discomfort comes from an IUD insertion. Again, as we always talk about, proper pain control during IUD insertions. Hopefully that makes it even better, but even with local anesthetic, things like that, it can be quite uncomfortable. A plus plus for the Miudella for that reason. All right, if someone's looking for an IUD that has to do that gives them the best advantage of bleeding control, that's an easy one. That's going to be your Mirena plus plus there. Maybe a plus for the Skyla, a plus, kind of minus, equivocal for that, equivocal for that, and unfortunately a negative for the Paragard, because the thought is the way that the copper works, the way that it's intended to work, it causes that inflammatory reaction in the endometrium that makes a hostile environment for sperm. And so that inflammation can also cause some irregular bleeding. Often this is within the first year of having the IUD. It does sometimes get better in individuals that are able to keep it for a little bit longer, but we do see some abnormal bleeding patterns, spotting, little bit heavier cycles with the Paragard IUD in some individuals. Some people notice it, some people don't. But unfortunately, it's not going to help decrease the amount of bleeding like we see with the Mirena, even to a lesser degree, the Kyleena IUD. With the Mirena IUD, sometimes after 6 months, on average, there's about a 90% reduction in someone's bleeding, which is, for a lot of people, a really nice thing. Some people don't like the idea of their menstrual cycle being taken away or lightened for whatever reason or belief they have. And so, again, Kyleena could be a good option for them. And then Skyla, we don't see a ton of reduction in cycle with that, but it's not going to make it worse. And since that Paragard has about 380 millimeters squared, so surface area of copper in it, the Miudella only has 170, so that's less than half. So the thought is less inflammation with the Miudella. Again, that's another positive over the Paragard, but it's still not going to be as good as the Mirena or the Kyleena for helping bleeding patterns. Actually, very similar story when it comes to helping people to improve their dysmenorrhea or pain with their cycles, the uterine cramping, pain with the cycles, and so, or even things like endometriosis or adenomyosis, common things that cause dysmenorrhea during someone's or around the time of the cycle. And so the Paragard IUD doesn't improve that, may potentially even make it slightly worse. Miudella, again, it's going to be better than the Paragard in that regards, less inflammation, hopefully. I think we have yet to really see that long-term data on these last 2 points for the Miudella. Mirena, I mean, that's going to be, again, the best for that. It's going to help make the periods much lighter, potentially even reduce them completely. And then with that usually goes the reduction in the dysmenorrhea. And so often people, if they want the best, lowest dose, less chance of side effects medication to help manage their dysmenorrhea, endometriosis, or adenomyosis, often that's the IUD. The Kyleena may be a plus there again, and then plus minus for the Skyla IUD there. When it comes to hormonal side effects, we talked about the Mirena IUD is the highest dose hormonal IUD, but it's still a very low dose. When comparing it to pills, progesterone-only pills, which is still very low dose of hormonal medication, compare that to the IUD. The IUD has like 20% of the amount of hormone in the system than the pills. So that's quite a bit lower. And then most of that progesterone is actually in the uterus. But each individual has their own sensitivity when it comes to hormones, especially synthetic hormones like the levonorgestrel. And so there is sometimes a chance of things like headaches. There is the chance of things like bloating. There is the chance of things like breast tenderness or mood changes. These are all hormonal potential side effects with every hormonal medication. And so you can still have that with the Mirena. And that's why we're going to give Mirena its first knock there. It's still pretty rare that someone has those side effects, but each individual has their own sensitivity to hormones. The Kyleena, that's going to be plus minus. I rarely, even more rarely see it with that because that's even lower dose. Same with the Skyla. Miudella, I mean, that's the whole positive of these non-hormonal options. So neither of those are going to affect the hormone production going forward. The next point I want to talk about is, well, what's the best option for somebody that hasn't had pregnancies before? Generally, this is marketed for younger populations, but I don't like that necessarily term because there are so many people that may have not had pregnancies before, meaning that something hasn't been there to expand the uterus or potentially deliver through the cervix, making it usually easier in that scenario to insert something through the cervix and uterus. Now, that's not always the case. That's just by far the majority from what we see, is that if somebody's had a vaginal delivery or a pregnancy in the past, usually the insertion of an IUD is subjectively easier for that individual. Now, again, still proper pain control, whether they, it is always offered whether they've had pregnancies or not. But again, usually if someone's had pregnancies before, it is substantially easier. So yeah, big plus for, these ones here, plus for the smaller diameters. We talked about that previously with insertion. It's kind of the same point. But maybe even another plus here. And so if something doesn't have hormones, it's small. I mean, that's a big positive over the Paragard, because I'm sorry, Paragard, but you get a negative. I would say Mirena is always easier than the Paragard in most situations to put in. And just the way the device is, the device insertion device. Paragard can be difficult for these people, not impossible by any means, but a little more difficult. EC stands for emergency contraception. What emergency contraception is, that if someone has unprotected intercourse or potentially trying to use contraception like barrier, like condoms, and they break, and they're worried about potentially becoming pregnant, there's a time frame from when fertilization actually does happen. And so someone, if they do have unprotected sex and they need emergency contraception, the Paragard IUD, up to 5 days after that event, can be used. And same with the Mirena IUD. We don't know, not enough data for the Miudella, so they don't recommend it, and really not enough data, and so that isn't really a thing for the Kyleena or the Skyla either. They would likely do Mirena IUD in that situation if someone wanted a hormonal IUD and needed emergency contraception. The last part that we'll talk about is the duration of use. How long is it good for after it's inserted? Well, it's often a big topic of conversation, and I think it goes without saying that if someone gets any of these inserted, they can remove them at any point they want, whether it's 6 months, a year. But the longest that it can be used before it's deemed ineffective would be, for the Paragard, it's 10 years. For the Miudella, right now it's 3 years. But that's because of the limited data, I think. I think that they'll approve it for longer, just like they did for the Mirena. They approved it initially, I think, for 3 years, and then it bumped up to 5. And then recently they gave it for 8 years for contraception. I still see the Mirena starting to fade in its bleeding benefits between 5 to 8 years. Kyleena is 5 years. Skyla is 3 years. So pretty self-explanatory. Paragard's good for a long time, the copper IUD. Mirena is also very effective up to 8 years. I don't think we have enough information yet, but I think the Miudella will be approved for a longer period of time once they have that longevity data of how long it's good for. So I hope this helped answer a lot of these questions. And if you stayed till now, give the video a like. The like button's just down there. If someone you know is interested in getting an IUD and you think this might help them, send the video to them, share it also. If you have any questions, of course, comments, other categories you thought might be useful that I didn't go through today, put it in the comments section below. Everyone have a great day and a good rest of your summer. Miudella. It's called Miudella.